Hello everyone, my name is Rob Henson and I'll be presenting IBM Watson Health. Watson Health, delivered through the cloud, analyzes high volumes of data, understands complex questions posed in natural language, and proposes evidence-based answers. Watson continuously learns, gaining in value and knowledge over time from previous interactions. So what is Watson Health and why was it created? Watson is an IBM supercomputer that combines artificial intelligence and analytical software for optimal performance as a question-answering machine. It is named after Thomas J. Watson, the founder of IBM. Watson was specifically developed to compete on Jeopardy! And in 2011 competed against former winners Brad Reuter and Ken Jennings, winning the first place prize of $1 million. Watson had access to 200 million pages of structured and unstructured content, including the full text of Wikipedia. It was not connected to the internet due to latency and questions around competitive fairness. Watson is made up of a cluster of 90 IBM Power 750 servers running in parallel. The IBM Power 750 server is not specific to Watson and is available for retail at $34,500 per server. The 90 servers that make up Watson cost around $3.1 million. Each server uses a 3.5 GHz Power 7 8-core processor with 4 threads per core. In total, Watson has 2,880 processor threads available. The cluster has a total of 16 terabytes of RAM. And just to give you a comparison, most laptops today have between 4 and 8 gigs of RAM. Watson can process up to 500 gigs per second or 1 million books per second. And Watson operates at more than 80 teraflops, or 80 trillion floating point operations per second. Several programming languages were used to code Watson. Java and C++, which are object-oriented programming languages, and Prolog, which is associated with artificial intelligence and computational linguistics. Linux is the operating system used, and around 90% of the supercomputers in the world use Linux. Now, other software includes Apache's Unstructured Information Management Architecture, and this provides infrastructure for the analysis of unstructured data. Apache's Hadoop, which supports the processing of large data sets in a distributed computing environment, and IBM's DeepQA software, which is designed for information retrieval that incorporates natural language processing and machine learning. So why does the healthcare industry need Watson? Well, the next two slides are pulled from IBM slide decks and help to illustrate why Watson can be a great asset for the healthcare industry. The healthcare industry is dealing with data overload. Over the course of a person's lifetime, 1,100 terabytes of exogenous data will be generated. Of that, 6 terabytes, or 30%, will be genomics data. And that's data that's around the genetics of the patient, including DNA sequencing. Now, 10%, or 0.4 terabytes of the 1,100 terabytes, is clinical and claims data. This includes electronic healthcare records, insurance claims, disease registries, and health surveys. With so much data, one would think the healthcare industry would have more than enough information to treat all the patients to the best of their ability. It's the exact opposite. There's so much information available, the healthcare industry is not able to keep up and process the data in order to provide the most effective solutions for the patient. In short, healthcare is dying of thirst in an ocean of data. 90% of the world's data was created in the last 2 years. 80% of the data is unstructured and cannot be accessed by current devices. And when I say unstructured, that refers to images and chart notes, data that cannot be easily imported or exported from a relational database. There are over 100,000 clinical trials running in parallel, and 75 new clinical trials start every day in the U.S. alone. According to Medline, an index of journal literature from the National Library of Medicine, there are over 424 million published articles in 5,600 journals. 1.8 million new articles are published each year. According to a paper written by Dr. Peter Denson, it is estimated that doubling time of medical knowledge in 1950 was 50 years, in 1980, 7 years, and in 2010, 3.5 years. In 2020, it is projected to be 0.2 years, just 73 days. In order for doctors to keep informed of new professional insights, they will need to read 29 hours each day. Medical knowledge is expanding faster, and our ability to learn and apply it is expanding faster than our ability to learn and apply it effectively. So IBM Watson Health is providing the healthcare industry a much-needed tool to wade through the ocean of data. And Watson can analyze massive amounts of data. Now, through cognitive computing, it is able to do the following. Watson understands. It is able to read and understand structured and unstructured data. Structured data like data sets and billing codes, and unstructured data like images. Now, through natural language processing, Watson can read social media posts, articles, and blog entries. Watson can understand various languages such as English, Spanish, French, German, Arabic, and Russian. Next, Watson reasons. Through the use of IBM's Deep QA software, it can parse input to determine key information. It can analyze patient data with current test results and examine all available data sources to create several hypotheses and test them. Watson can incorporate the patient notes, research studies, clinical trial results, and journal articles into the analysis. Once complete, Watson will provide a confidence rank for each hypothesis and provide evidence to support the findings. And finally, Watson learns. Watson is trained by leading experts in various medical fields. And by using question-answer pairs, Watson is able to learn the linguistic patterns in the domain. Interactions between users and Watson are periodically reviewed by experts and fed back into the system to help Watson better interpret information. And as new information is published, it is updated so it is constantly adapting to changing knowledge and linguistic patterns. So now we come to how Watson Health was formed. Over the last few years, IBM has been acquiring companies to provide data so that Watson can analyze it and be more effective. So Watson Health was formed when IBM acquired Phitel and Exploris in 2015. With the acquisition of Phitel, IBM gained cloud-based population health management software that works with providers' current electronic healthcare records to reduce hospital readmissions, increase compliance, and create a registry of patients. With Exploris, IBM gained one of the largest clinical data sets in the world, representing more than 50 million lives. Exploris compiles the data from financial, operational, and medical record systems from over 360 hospitals and more than 317,000 providers. In October of 2015, IBM acquired Merge Healthcare for $1 billion. With this acquisition, Watson gained access to over 30 billion medical images and 7,500 healthcare sites that utilize Merge Healthcare services. IBM's latest acquisition is Truven Healthcare, which was purchased for $2.6 billion. Truven is a leading provider of cloud-based healthcare data, analytics, and insights. It brings more than 8,500 clients to the Watson Health portfolio. And that includes U.S., federal, and state government agencies, employers, health plans, hospitals, clinicians, and life sciences companies. Data and insights from Truven inform benefit decisions for 1 in 3 Americans. Now, IBM will be able to leverage extensive data spanning cost, claims, quality, and outcomes information. Now, all these acquisitions give Watson Health the needed data to improve the ability of doctors, researchers, and insurers to innovate by surfacing insights from the massive amount of personal health data being created and shared daily. The Watson Health Cloud allows this information to be de-identified, shared, and combined with the dynamic and constantly growing aggregated view of clinical, research, and social health data. Now, the next 2 slides will illustrate some of the healthcare challenges that Watson Health is currently working on. The first challenge is in the area of genomics. Well, Watson Health has partnered with Quest Diagnostics to combine state-of-the-art solid tumor genetic sequencing with powerful data analysis. So what happens is a doctor sends in a sample for testing. Next, Quest Diagnostics sequences the tumor's genomic makeup to help clinicians understand the unique cancer-causing mutations specific to that individual patient's care. Watson then compares the patient's results against relevant medical literature, clinical studies, and carefully annotated rules created by leading cancer centers. After that, a Quest Diagnostics medical director reviews the Watson reports, confirms the results, and prepares a report for consideration. And finally, the doctor receives a report from the Quest medical team and provides therapy and clinical trial information that has been personalized to the patient, including mutations and therapeutic associations that have been graded through clearly defined levels of evidence. Now, another healthcare challenge is in the area of oncology. Trained by leading cancer experts from New York's Memorial Sloan Kettering Cancer Center, Watson can provide clinicians with evidence-based treatment options. With the acquisition of Merge Healthcare, Watson now has access to 30 billion medical images, including x-rays, CAT scans, and other images available. Cancers such as melanoma can be difficult to diagnose based on the variations in appearance from patient to patient. By using automated image processing, Watson can be trained to recognize very subtle but important features associated with the disease. New images from a patient can be compared with many others in a database, and then be provided to the doctor about the diagnosis and potential treatments. So that concludes the presentation on Watson Health. I have included some questions. I would think the machine learning and artificial intelligence replacing human counterparts will be an interesting discussion with all the members of the group. I would really like to hear, your opinions on this, and then also what other industries do you think, Watson can be applied to? And then last but not least is my source slide. As you can see, I had various sources for this. Watson Health is very in-depth, and it's very fascinating. Now, I hope you learned some great things from this presentation, and I really appreciate you listening and watching the slides. Thank you very much.